What are goblet cells in Barrett's esophagus? Imagine cells that are usually found in the intestines suddenly showing up in your esophagus. That's what happens with goblet cells in Barrett's esophagus. They are specialized mucus-producing cells that normally line the intestines, not the esophagus. When someone has chronic acid reflux or gastroesophageal reflux disease, the lining of the lower esophagus can change. This change is called metaplasia, where the normal squamous cells are replaced by a different type of cell. In this case, the new cells include goblet cells, which are not normally present in the esophagus. This transformation happens because the esophagus tries to protect itself from the constant damage caused by stomach acid. The acid irritates the lining, and the tissue adapts by becoming more like intestinal tissue, which naturally has goblet cells. These cells produce mucus that helps shield the tissue from acid damage. Their presence is a sign that the tissue has changed to a more intestinal type, which is called intestinal metaplasia. Finding goblet cells during an endoscopy and biopsy confirms the diagnosis of Barrett's esophagus. Under the microscope, goblet cells look quite distinct. They have a mucus-filled cytoplasm that stains clearly, making them easy for pathologists to identify. The number and appearance of goblet cells can also tell doctors how severe the tissue change is. This is important because the presence of goblet cells is linked to a higher risk of developing esophageal adenocarcinoma, a type of cancer. In people with acid reflux or gastroesophageal reflux disease, the appearance of goblet cells signals a complication that needs careful monitoring. Regular endoscopies help keep track of any changes or abnormal cell growth, which could lead to cancer if left unchecked. Treatments for Barrett's esophagus may include lifestyle changes to reduce acid exposure, medications like proton pump inhibitors, or procedures to remove or destroy abnormal tissue. So, in simple terms, goblet cells in Barrett's esophagus are mucus-secreting cells that appear where they normally don't belong because of long-term acid damage. Their presence helps doctors diagnose the condition and assess the risk of cancer. Recognizing these cells is a key part of managing and monitoring this condition effectively.